Hello, everybody. Thank you for joining us. I am Dr. Saurabh Joshi from the Vein Center, and today, along with me, is my good friend and colleague, Dr. Rohit Basapure, and we are going to talk about thyroid nodules and swellings of the thyroid. So, and to know more about this, Dr. Rohit is going to help us. So, hi, Rohit.
Hi.
Hi. Can you let our viewers know what is the thyroid gland and what is this thing called thyroid nodules?
Yeah. So thyroid gland is a butterfly-shaped gland that is located in the neck. Okay. So it helps regulate the growth, metabolism, and energy of an individual. Okay. And thyroid nodules are focal growths in the thyroid gland.
Okay.
They could be cancerous or non-cancerous. Right. So commonly, thyroid nodules are uh, visible on the neck by fullness of the neck or visible lump on the neck. It can cause difficulty in swallowing or difficulty in breathing. It can sometimes also cause voice changes if it is a large nodule, which can compress on the underlying larynx. So, the concern with the thyroid nodules is early detection and monitoring is very important. Uh, commonly, it is diagnosed in a way that a patient or say relatives of the patient usually notice painless lump on the neck. Um, the patient can feel a foreign body sensation in the neck while swallowing or even while talking. Uh, there is sometimes throat tightness or discomfort, and patient frequently has cough and hoarseness of voice.
Okay. Uh, Great, thanks for telling us. There is something about some people developing more risk of developing these thyroid nodules. So certain risk factors for developing thyroid nodules are this iodine deficiency in the diet, and also people with family history of thyroid disease whose parents or brothers sisters might have it may have a more likelihood of developing it. Women, incidentally, are 2 to 3 times more commonly seen to be affected with thyroid nodules than men. And as age advances, after the age of 50, thyroid nodules are more common. Some patients who are having a history of past radiation treatment in the neck area may also develop thyroid nodules. And there are these ways of, how do we diagnose thyroid nodules? Firstly, by clinical examination. So when you go to your doctor, the doctor would be able to see the increased size of the thyroid. They might even palpate or touch and see, okay, to know the shape of the thyroid and how does it feel. After that, there will be some blood tests. These are thyroid function tests to assess your thyroid hormone levels. Uh, Ideally, a ultrasound examination, that is a sonography of the thyroid, which is the gold standard way of looking or diagnosing a thyroid nodule, where we would see the size of the thyroid, the number of the thyroid nodules, the internal features of the thyroid nodules, and get a fair idea whether this may be a cancerous nodule or not, or is a benign nodule. And after that, there is also something called as a fine needle aspiration cytology. The FNAC is where a needle is placed in the nodule and a small part of the nodule or some cells are aspirated, and then they are tested in a laboratory. This tells us whether a malignancy is suspected or is it truly a benign nodule. Dr. Rohit, can you tell us what are the possible treatment options for these thyroid nodules?
So, commonly, once we have diagnosed a thyroid nodule by ultrasound or FNSC, the treatment options include either medication like thyroid hormone suppression in few cases, uh, 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 sometimes surgery like lobectomy or total thyroidectomy needs to be done in case of a large nodule, and especially if it is suspicious of malignancy. In recent times, a new technique like thermal ablation and RFA ablation have come up, which have shown very good results in treatment.
The term thermal ablation, radio frequency ablation or microwave ablation, sounds very futuristic. And can you please explain a little bit for our patients and the viewers to know what does this really mean and how is it done?
Yeah. So microwave ablation and radiofrequency ablation basically use heat to treat a particular nodule. It is as it sounds. Microwaves, like we use microwaves in our house to heat up food and all. Uh, these are very focused microwaves which are targeted only on the nodules. So the procedure is very straightforward. So the procedure happens in an outpatient setting under local anesthesia, or if required, mild sedation. We use ultrasound guidance to target the particular nodule which we want to treat, and we place a tiny antenna in the nodule itself for treatment, and energy is delivered inside the nodule itself and not to the surrounding normal tissue. And when we say energy is delivered, that means almost particularly 80 degrees Celsius temperature is delivered to the nodule itself, which causes the necrosis of the cancer cells or the nodular cells. And we monitor these ablation real time under ultrasound guidance. And the patient can go home on the same day. That's the best part about this treatment. Apart from that, the patient doesn't have a surgical scar because the entire procedure is done through a needle hole. Uh, it can cause just minimal discomfort, unlike, say, surgical techniques where the discomfort can be for a longer duration and there tends to be a scar after the surgery. And because the procedure is done under local anesthesia, a patient doesn't have to go through the pain for longer duration. And after the procedure, the recovery is much faster than surgical techniques. Patient can go to their routine work or day-to-day job within 24 hours itself. Again, one more important point about this procedure is the normal thyroid tissue around the nodule is preserved because we focus only on the nodule for the treatment. um, and patient can come and go in the hospital within a day itself.
So, considering, say, if a patient has had such a treatment, what can they expect? How do you expect the recovery? So, if I imagine I have a thyroid nodule and I've had this treatment, when can I expect the nodule to go? Does it disappear instantly, or is it a process? And if so, I mean, how long does it take?
Yeah, it depends a lot on what type of nodule we are dealing with and how big the nodule is.
Mhm.
If the nodule is fairly large in size, it can take up to 6 to 12 months for its reduction in size by almost 80 to 90%.
Okay.
As the size reduces, the symptoms of the patient also improve. Say the neck fullness and the tightness also improves, the hoarseness of voice also comes down. And the safety profile is much better with microwave and radio frequency ablation, and there are less complication rates. And most of the times, patients doesn't have to take lifelong medications for thyroid function and all.
Great, great,
Yeah.
great. Thank you for letting us know about this amazing treatment. And for our patients, if you would like to get yourself examined or think that you have a thyroid nodule or have been diagnosed with a thyroid nodule, please feel free to drop by and for an examination ultrasound scan, and we can see if you are the right candidate to do this. Thank you.
Thank you.
Thank you. Thanks, Dr. Rohit.
Thank you.